Hello again. This is Professor Papier Bernstein, and this is mini lecture number 4. And this is also meant to, I'm going to talk a little bit about the textbook that you'll be using. And in my next lecture, I'll be doing an overview of your textbook. But right now, I would just like to spend a few minutes talking with you about what this course conceptually is supposed to be about. And it's about something called observation. And the concept of observing, while it seems to be pretty simplistic, I mean, you look at something and you watch, it can actually be quite complicated because observation consists of, and this is somewhat philosophical, it really consists of 3 things. It consists of the observer, the thing, or the person being observed, or the circumstances being observed, and then the relationship between the two. And we talk about the relationship because everything really can change by virtue of an observation. An observation can actually change the nature or the course of what's happening. Such may not be the case, especially if your observations are remote, but when we do person-to-person observations, for example, a supervisor coming in to observe an SLP can alter the course of what is going to happen in that session. We're not going to talk about that in detail now, but I do want to talk about the nature of clinical observation just for a couple of minutes. Any clinical endeavor begins with observation. Observation is always the very first thing that we do as professionals. If we're involved with the medical setting or the educational setting or the rehab setting, the very first thing we're going to be doing is observing our clients, patients, or students. It may be done in conjunction with an assessment or in conjunction with a questionnaire, but there's always going to be an observational component, and there is an observational component in every therapeutic session as well. Observation involves the integration of many things. It involves our personal beliefs. It involves our academic knowledge. It also involves our clinical skills and our practical experiences, because everything takes place within a holistic perspective. And the individual in this particular case is in the center of it all. So everything that we do in this field begins and ends with observation. And remember, observational skills are not unique to our field because they must be developed in every field that involves people. In all humanistic fields that require educational practices and training and clinical practices and training. And it has to take place in all fields that integrate interprofessional education, meaning education that kind of comes together from a lot of different sources. And it must take place in all fields that expect to experience best clinical outcomes. Okay? So I want you to think about that in relation to the concept of observation and what it means. Now, your textbook is going to be one of your tools, and you have almost like a map of the textbook as one of your course documents. And I'm not going to be going through that right now. I will do that in another lecture. But I just want to give you some general information about your book because it's not a traditional textbook for excuse me, for a number of reasons. First of all, it's not a textbook that's structured around a particular speech, language, hearing, or swallowing impairment. Okay? It does not address a specific type of communication disorder. It's a book about the process and the practice of therapy, and specifically about the development and the importance of developing 4 attitudes that will have a profound impact on your clinical success, and not only your clinical success professionally, but on your professional satisfaction with having chosen this as a field. So what are those 4 attitudes? A scientific attitude, a therapeutic attitude, a professional attitude, and a leadership attitude. And it's really about a philosophy and about helping you develop what I call pillars of practice that will support that philosophy and become the underpinnings of each of the attitudes. So your textbook is going to act as a kind of field guide with kind of guideposts and stepping stones along the way. And it's really about you. It's about the development of you. It's about the development of you as a clinician, and it's really about the characteristics of the clinician in conjunction with the client, and how all of these characteristics and these attitudes will impact the therapeutic relationship. So it's a book about not only the science of our field, but it's really about the art behind our practice. And most of all, it's about the heart and soul of our work, which is going to serve to nurture us and thus sustain our profession, because it will keep us happy and forward moving in our profession. So a lot of the information that you're going to read is not unique to us in our field. And actually, a lot of the information is not new. In fact, it evolved from centuries of learnings across the world, across a variety of cultures. And sometimes that's kind of talked about. It really takes a very broad humanistic view. And that kind of view, I really believe, is of great value to us in our field, because we never really know the experience of another person, but we can learn to appreciate it. And the more we can expand our own world views, our own perspectives, our own ways of thinking, and expand our lenses, the better equipped we will be to understand those of our clients, patients, and students. And keep in mind that the very title practitioner serves to remind us that the provision of quality clinical, educational, medical care requires lifelong learning. We never know it all. And we will always be practicing and learning, and that's why we are on the practitioner's path. Thank you.